Namaskar, myself Dr. VIPUL Gurjar. I am the professor in Vadodara SBK's Medical College. Today I am going to discuss about the laser and pilonidal sinus. First, there's some basic point of pilonidal sinus. Pilonidal sinus, it is a opening surrounding the sacral cleft in a lower part of the body, and mainly it is considering because how it develops because of poor hygiene. Second, hairy area, and third is the long-term sitting posture. One theory is that suction theory while walking, because of this cleft there will be a suction environment is developed, and because of this negative suction the suck out in the subcutaneous tissue. This is a theory, but I am not sure about this sentence. Okay. After the developing of this pilonidal sinus, if it is an abscess or if it's in acute condition, we should not try any surgery because it is considered as a clean surgery. And if it is an abscess, drain it, give antibiotic, make it mature, and the fibrotic one, then we can do the real surgery. Is there an investigation? Yes, there is a no need of investigation for the pilonidal sinus, but sometimes these pilonidal sinus are associated with the anal communication. So it may be considered as a fistula, or the pilonidal is reaching to the anal canal as a secondary source. So to rule out that thing, we should do the MRI, or we should confirm the its communication with the anal canal. Different type of modality is available for the treatment. First is the wide excision and primary closure, but the failure rate is too much high. So the flap surgery is a recommended surgery for pilonidal sinus. But after the development or after the coming of laser, it is very much accepting surgery for the pilonidal sinus. For me, I am not that much confident about the laser used in a pilonidal sinus. I still recommend it, and I am getting good result with the flap surgery. But because of the laser, the demand by the patients as well as the less morbidity, we can do the laser surgery in a pilonidal sinus. So with the I am doing with the good explanation about the recurrence rate and everything, as well as a comparison of flap surgery and pilonidal laser surgery, the morbidity, complications, stay, cost, everything. Many people are undergoing with the acceptance of recurrence and everything with the laser surgery. And still, after doing a many laser surgery, I am also getting a good result, but still my upper hand is over the flap surgery. How do the laser surgery, how do the laser surgery in the pilonidal sinus, and how why I don't like a laser in a pilonidal sinus? Okay. The pilonidal sinus, actually it is a cavity and a sinus with the hair root infection in a cavity, and because of the less subcutaneous support, the skin as over the and there is a gap, there is a no subcutaneous pad between the skin and the sacral region. That's why these sinus are difficult to heal. Okay. uh, what we are doing in the laser surgery, after the application, after the positioning of the patient, we instill the methylene blue or any solution to see the communication. Laser surgery are should be done with the radial fiber only, as well as we are keeping the machines at the 10 to 12 watt, like a fistula surgery. First, we try to remove the pits in the sacral cleft with punch biopsy. Multiple punch biopsy with a different diameter are available on the Amazon. They are the sharp cutted instrument, so we can use that, remove the punch biopsy, pit in the sacral cleft. If there is a one sinus opening, we should remove that sinus entirely till the good healthy cavity, as well as try to remove all the foreign body like hairs as well as infected tissue from the cavity. Here in this condition, sometimes if we miss a foreign body, then recurrence of laser surgery is possible. To decrease this recurrence, if you are have a fistuloscope, this recurrence rate may decrease, because with the fistuloscope you can remove all the foreign materials from the cavity. Now, how to deal and what is the trick of laser surgery? I always do and always try to keep a lateral entry or one lateral entry for a laser fiber. If there is one single cavity opening is available, then I'll making a artificial opening in a lateral position with a punch biopsy. Then I'll pass out the probe. Over that probe, I'll pass out the infant feeding tube to guide our laser fiber. I use a 10 size feeding tube. After passing this feeding tube, I insert the radial fiber in this 10 mm feeding tube, and then I'll pull out the infant feeding tube, so the laser fiber tip will not damage. Then as a like a fistula, I will pull the fiber with 1 centimeter with 1 millimeter per second. With this energy, it deepithelizes the surrounding cavity and it damages the tissue in a controlled manner. After the sort of treatment, I do the vigorously the scraping and remove all the damaged or deepithelized tissue from the cavity, from a sinus cavity to the artificial entry. If I feel, I'll do the 2 times for this laser as well as for the scraping. In a 3rd time, I'll do the laser, and during this withdrawal, I put the eyes and compress distal to the radial fiber tip. This compression will help to obliterate the cavity, and which is our main aim. In a flap surgery also, our aim is the excision and then obliteration of cavity. Here, because of the laser fiber and energy, heat coagulum is formed, which is sticky, and that obliterates because of the contraction of the tissue, which obliterates the cavity somewhat. It is not 100% obliterate. So we compress it and slowly the fiber are removed. But after this 2nd or 3rd, with the trying of obliteration cavity, I will not further do the scraping. And if I have entered a lateral opening, or sinus tract is a lateral opening, this lateral opening can be closed with the deep bite, but I'll keep open to drain the cavity properly. This may be the artificial my punch biopsy or the pit biopsy, pit opening is there. Then I'll do the compression dressing, and I'll not touch for 2 to 3 days until unless patient will have some symptoms of infection. This long-term compression and dressing may help to obliterate the cavity early. So the laser surgery in a pylonidal sinus I am doing like this. Why I am against? I believe that during the whole entire thing, most important part of this laser surgery is not the laser. It is the removal of foreign body, and the adequate scraping is an important role. Laser just help to deepithelialize and damage the entire epithelial lining in a controlled manner, so we can scrape out all the cavity. So that's why the laser has a limited role, but the efficacy is very good in a surgery I am getting. This is my personal view. You can share and you can experience according to your skill. Thank you. Also, I have also sent videos of live surgery. You can go through it. Thank you very much. Bye.